Well, hello everyone and welcome, and thank you so much for joining us today for our webinar, What 10 Years of Healthcare Engagement Data Says About AI, Compliance, and Member Experience. I'm Lindsay Goldfarb, Marketing Leader at Engageus, and I will be your moderator today. So before we dive in, I would like to go over a few logistical items to help you get the most out of today's session. Today's session will be recorded, and we will be sending out a link to the recording after the webinar, as well as a PDF of today's slides. Also, we encourage you to use the Q&A feature. You'll notice that at the bottom or on the right-hand side of your screen. You can use that to submit any questions for the speakers throughout the program, and we will host a question-answer session near the end. Finally, if you have any technical difficulties, you can use the chat function and you can message the host directly and we can help with that. So without further ado, I am so delighted to be joined by today's speakers. So first off, we're joined by Jack Newsome, partner at Engageus. Jack has over 25 years in healthcare, specializing in consumer engagement, analytics, and communication strategy. He's led several national surveys and large teams focused on improving outcomes through data-driven approaches and optimized communications. We're also joined by Yvonne Doherty, Global Head of Industries at Usher, an AI-powered customer experience automation company that's driving more effective member communications for healthcare companies worldwide. She brings more than 30 years of experience in healthcare marketing and communications leadership and specializes in more effective and influential omni-channel communications that drive engagement, better experiences, and better outcomes. So thank you both for being here with us today. And Jack, now I will hand it over to you to dive right in.
Fantastic. Thanks a lot. My name's Jack, and today we'll be talking about, I'll kick things off and talk about the results of 10 years of consumer engagement studies that we've been doing with our clients and with other plans and sponsors across the healthcare industry. And then I'll be passing things off to Yvonne a little bit later on, and we'll tie things up with questions at the end. So let's go ahead and get started, please, Tara. Okay, so let's go one more and one more. Excellent. So for 10 years now, we've been running a survey every year where we reach out to plan executives and executives of health tech companies and ask them a series of questions around how they engage with their members and clients, what sorts of technologies they use, what sorts of challenges, what they're planning to do in the next year. And so we've got a lot of data and a lot of trend in terms of where things are headed and what's likely to become increasingly important issues. So some of the things that this year really popped to the top of the list include people calling out really tight budgets. I don't think that's a surprise. CMS gave Medicare a relatively small bump this year, and Humana this morning reported MLRs up over 90%. So a lot going to medical costs, right? So budgets are tight. Part of the response to that, I think, is continuing to push members towards digital channels. They're not only are they more less expensive, but they're also, I think, at a point where folks are increasingly engaged and interacting with them. We did some work not long ago with disabled population, and folks were absolutely looking to digital channels, text, email, as their most preferred channels, right? I think we've gotten past some of the concerns about mail and phones and things like that. Social determinants of health programs are continuing to be important, although they're no longer part of the CMS bonus programs. The survey that we did this year, we do it in the fall, and it's kind of interesting that you'll see folks were sort of expecting, I think, the SDOH bonuses to fall by the wayside. It's almost like a prediction market, if you think about it that way. And then I think
I just wanted to chime in. We all know that there's less interest, less funding, but if people aren't able to handle basic needs, they're less apt to do the more important things that we all need them to do health-wise and wellness-wise. So this is such a conundrum, with what's going on. So happy to talk more about that later, but just wanted to jump in there.
Yeah, no, great point. Thank you for reminding me. Yeah, so these populations these folks who need more help aren't going away. They continue to need more help, and it's on the plan then to help them to get there. And then lastly, again, we'll be passing things over to Yvonne a little bit later on, but the real focus is on AI, as just a lot of interest in that, and plans are starting to figure out how to make use of it, and we'll get some more insight into that as we go. Let's go forward, Tara, please. So let me just sort of lay things out. So the survey, again, we've been doing this for 10 years now, and what you'll see is a series of bars or data points associated with each of the answers. Sometimes you'll see some jumping around from year to year as the sample population changes a little bit or issues become more or less important. But I think we can still definitely look to these for trend and for direction without a doubt. And so one of the things that you really see is over here on that sort of middle right is more and more folks are focused on member engagement, right? And these are the roles when we ask people what they do at a health plan. More and more people are saying member engagement, right? And again, that's a function that goes across everything that we want them to do, whether it's we want them to get mammograms, whether we want them to go to the ER, go to a different site of care instead of the ER, whether we want them to do something around engaging with telemedicine. All of that requires getting and connecting with people before you can do anything else. So let's go one more, please. The folks that we've been surveying really do tend to skew towards sort of a middle upper layer of management, lots of directors, vice presidents. I think that reflects probably the growing complexity of some of these kinds of issues and the need to work across different silos. And so by definition, within a plan, you're going to have to start to get a little bit higher in the organization before you can start to get that sort of visibility and opportunity. So let's keep going here, Tara. All right, so let's go ahead and jump into the details of things. So this is probably one of the most important questions we ask, and it's, has your budget related to consumer engagement been growing, shrinking, about the same? And on that left-hand panel, you can see things go from shrinking to growing by at least 10%. And for the first time ever, we have a majority of people this year saying that their budgets are not growing. Okay, so a lot of people reporting shrinking, a lot of people reporting staying the same. And so it makes sense then when you toggle over to the right-hand panel, when you say, how much attention is my department getting? Again, it sort of follows the amount at which their budgets are growing, right? It's definitely falling off, and fewer people are saying that the attention that they're getting is increasing as the size of the budget growth slows. Okay. So what are they doing with these money? A lot of them are spending a lot of this energy on reaching out to members, doing engagement. And so, how are they doing that? And what you can see is that over time, again, we've got 10 years of data. So if you look over to the middle there, we've got some things around email. We've got text is included in there, and those are all on the rise, right? A lot of the other channels are relatively flat to declining. I think automated calls, it jumps around a little bit, but I think is probably trending off a little bit. I'm sure folks are really disappointed to hear that as consumers, but that's where folks seem to go. And again, I think a lot of this is probably focus on cost. But if we go one more, we also ask folks about the effectiveness of these channels, right? And so not only where's that money going in terms of how much it costs to communicate with members, but then where do they get response and engagement from members? And what really jumps out, I think, on this slide is over in that sort of middle right, is we've got some information around portals appear to finally be coming into their own, right? For a long time, we've been trying to drive members to sign up, to register, to go there as a source of to go there as a resource and to use them. And you can see that more and more, half the people then in this survey reported that as their most effective channel. So absolutely something that's going in the right direction in terms of using technology to engage members. Let's go one more, Tara. So another thing that we like to ask folks then is, what are some of the challenges that they have in terms of achieving all of their objectives and goals for the year, right? And we ask them about, is it internal capabilities? Is it budget? Is it skills? And one of the things that you glean from this slide is that some years, like several years ago, you can see sort of those teal lines, for example, it just felt like everything was hard, right? It was hard to get anything done. The good news is a lot of those bars have come down, But the one that really stands out is that one second from the left, which is focused on budget, right? So again, ties together with this recurring theme of money's tight, challenges are hard, scrutiny, or there's less money to be had, and so budgets are popping to the top of the list as something that's really important. Let's go one more, Sarah. And again, if you sort of follow the money and think about that, if we're focused on money, then it's not surprising that they're in the middle. The way that most programs and initiatives are likely to get graded is on ROI. Okay, and you can see that some of the changes from left to right have drifted around a little bit over time. Over on the left-hand side, you can see response rate used to be a pretty straightforward and most common way to assess the effectiveness of different programs, right? Just how many people are engaged. I think what you're seeing now is not just how many people are engaged, but pulling it all the way through and say, are they doing the kinds of things that we want them to do, right? We've worked with some clients, for example, where we've done a lot to improve engagement, but then they're tying it all the way through to our folks really doing what we want them to do, which is in that case, it was use the emergency room less often. Or get refills.
Jack,
go ahead. Yeah,
I just wanted to jump in here. So we're seeing this too at Usher. ROI doesn't mean response, doesn't mean click-through. It means members taking meaningful actions, whether that be getting educated and aware of their plan benefits, closing gaps in care, population health, wellness, things that are hard to get people to do, but that is what people have their feet to the fire to deliver on. ROI has definitely changed. I've been in this world for 30 years and it is pretty intense. So definitely good to see this popping in your survey and know that we can help with this.
Absolutely. Yeah. Let's go one more, Tara. So in addition to asking folks about how they're getting graded and measured and assessed, right, we ask them what they want to be doing, what are their goals for the next year. And clear standout here is over on that right-hand side again, is AI, right? Folks are really interested in trying to find ways to bring AI to bear in healthcare. And again, I think as Yvonne was pointing out, there's a tremendous opportunity to improve service, reduce costs, get people the information that they need, get them to do the things they want to do by using AI, right? So it's a powerful tool, and that's where everybody's mind seems to be. And so if we go one more, we pushed that and drilled into that just a little bit to see, okay, great. How much progress have you made to date? And I think, this is consistent with McKinsey had some information that they published earlier a week or two ago that was consistent with this, that plans in particular are lagging behind other industries in terms of AI adoption and making it work. But I don't think that's a surprise. You've got an extraordinarily complicated service that's very highly regulated, a lot of legal implications and medical implications for what you're doing, right? It's a tricky place to start. And so some of the things you see then called out on that right-hand panel are where are folks trying to use it the most, and what we see there in that top right is content creation is one place where folks are trying to use AI more quickly than other applications, which again, it makes sense. You've still got a human in the loop. You've got an enormous amount of material that you need to get out to folks. It's a good place to get help from a tool. And then on the bottom right-hand corner, what you can see in there is what's holding folks back. And again, it sort of ties with this theme of it's a complicated, difficult environment to do things. It's regulatory and compliance seems to be some of the top issues that plans and health tech companies are reporting as an impediment to getting AI implemented and executed with their population. So again, that makes sense. Again, that's what Yvonne's going to be addressing in a moment or two, is how can we help folks overcome that challenge and execute on what's possible. So let's go one more, Tara. So in addition to AI and what their priorities are, we've got this. We also asked folks just what are their goals for the next year, right? And I think all these, it's everything we just talked about, right? We've got artificial intelligence. Making AI work is absolutely a critical goal for probably everybody in every organization, not just in healthcare. within healthcare and the folks we've been surveying, right, pushing folks to this digital experience is also really important, right? How do we make that work? How do we make it seamless across different channels? How do we connect with members where they are, when they want information in a way that makes sense to them, right? So it's multi-channel, it's orchestration, it's next best action are all parts of that. And then all that has to be done in a world of shrinking budgets and tight resources, right? And so keeping an eye on the ROI, keeping an eye on streamlining and not spending more and more money without getting more and more a commensurate bang for the buck is going to be important for that. So let's go one last, Tara, for me, and sort of wrap things up then, right? We've hit on all these themes. We've got budgets are tight, folks are watching how much people are spending. Digital engagement is increasingly important, reaching people where they are. AI is something that everybody's got their eye on and really trying to make work despite some of the challenges around compliance. And then, as Yvonne was pointing out at the top of the presentation, those SDOH, the LIS populations, the duals, the disabled, they need more help, right? And they're not going away. And whether plans get bonused on that or not, they still need to care for those populations and make sure that they're getting the services that they need. So with that as a background, I'm going to pass things over to Yvonne to talk more about how that AI component can become something that your plan turns into a strength and can deliver on ROI. So over to you, Yvonne.
Thank you so much. We can go to the, yeah, perfect. Jack, thank you so much. I originally saw your webinar on the findings on this, and I was just so glad to see everything that you're keeping your finger on the pulse of. I actually go back a really long time to the founders of Engageus, and I always love how you are keeping up with what's going on and also able to jump in and help plans quickly get where they need to go in areas like this. You mentioned a lot of things that are hitting this world I've been in for, you and I have been in for our careers is getting really harder and harder. So I'm really excited to share some things that are really going on now with digital communication, with AI for engagement in healthcare that is highly compliant, that is actually making really meaningful business impact. So we can jump to the next slide. I wanted to pull back up one of your last slides, Jack, because this is something that when you shared it, we are working on this together. We are solving for these things for health plans. And, the artificial intelligence, being able to use AI to get to that ROI that you mentioned, everyone still has their feet to the fire for. AI can deliver that. It can be compliant. It is. It's in action now. So digital engagement, we've all been in this space between Engageus and Usher for us more than a decade, focusing on really compliant, really effective, really different types of communication, interactive, HIPAA secure. So the whole realm of digital engagement has really changed, and it is in action and it is making a difference. So I want to share that. And it is, you have here promoting portal adoption. Everyone's invested a lot in their apps, in their portals. The right digital communications can drive signups as well as ongoing adoption to help with those always important ROI. So, and then saving money. Digital communications in general really do save money, make things more efficient, focus more and reduce reliance on live resources, clinical, non-clinical, freeing them up for more value-added things. Driving some operational efficiency with print and mail. We are delivering a lot of things like digital ID cards and other materials that can significantly save on even mailing costs, because we know every dollar matters. And so trying to squeeze as much as we can into the save money bucket is very important. And I also pulled something from another of your slides because I'm going to go a bit into this. I'm very passionate about it. AI adoption may be starting, but some people believe it's hindered by compliance. We have proven with plans, particularly Medicare, Medicaid, that compliance, auditability, following regulations is possible in the AI world. So I'm going to get a little bit more into that, and then we can wrap up. So you can jump to the next slide. So as I mentioned, we do have digital communications, HIPAA secure digital communications live in the marketplace nationwide. Health plans, all divisions, huge focus on Medicare and Medicaid, especially with AI, which I have been thrilled to have a way to reach these vulnerable members, these transient members, these hard to reach members, really, really effectively to get them to actually take action. So I was very, very surprised that our Medicaid MCOs went first with AI. And I've really been loving seeing that. And I'm going to dig in a little bit of what we're seeing, but there is safe and compliant AI in practice. And what it's delivering is a bit of what you mentioned is needed. Better member experience, better overall outcomes, including health outcomes, allowing plans to have 24/7 intelligent support that actually helps people complete actions and get what they need in moments that matter, because we all know we're all healthcare members. Healthcare needs don't stop when member service is closed. So this is a great way to fill that in. It gives really personalized, really timely, very, very accurate guidance. Languages are very, very important. Ours is in 74, even the languages that read right to left. We know that's important. It is able to improve health literacy, support access to care and resources, and then seamlessly bridge to live resources for chat and calls when appropriate. There's always going to be a need in this world, the complex healthcare world, for live. So it's really important that that bridge be done and ready. We don't want to have people have to repeat themselves. We don't want them to have to drop from digital, look up a number. So reducing friction. It is driving significant operational efficiency and cost savings. It can be done and implemented very, very quickly. We know we've been implementing sometimes within a month and getting things live. So, I'll share a little bit about how we can get started quickly, but reducing contact center volumes, delivering after hours support. I mentioned allowing live resources to focus on higher value, increasing operational efficiency, reducing print and mail costs, for example, delivering digital ID cards. And then it really is able to improve compliance and regulatory adherence, auditable, very, very auditable, and having great strategic impact. So we are together seeing increased star ratings, CAPS scores, other scores, boosting plan retention and member loyalty, boosting NPS. It is a great experience when you do digital right. It is increasing utilization of core resources, wellness programs, rewards programs, as well as providing health equity support. As you mentioned, budgets are tightening because of factors like CMS, HR1, so many things, but health equity still matters, and people do still need the support. You can jump to the next slide. So this is just a quick peek into what safe and compliant digital communications and AI agents look like in practice. So AI agents can be trained like a live agent. They can think, act, and learn. Just like a real agent, they can be on chat. They can speak via natural language on voice. Text is not HIPAA secure, but text can get them into HIPAA secure digital channels like what we offer. And these can be blended together. So someone can be on the phone and get a secure message, and the the phone can guide them through. So very fascinating how advanced this is. AI is HIPAA compliant. It's very, very important that when you're having interactions where there's PHI, PFI, that it is HIPAA compliant. So we do have channels that are secure, encrypted, high trust certified. For me, I've learned through my clients, it's just as important that AI agents know what they should not do. That can be set up really, really easily. We have a no code platform, and you just define what it can't do, what it can do, how to escalate and when to escalate to live resources, leveraging knowledge. This is the key difference. AI can be built very, very specific within healthcare domain specificity, client domain specificity. It can be trained on the knowledge bases and the information that you use to train your live agents. Train it the same way. Give it its information. It can be integrated in with core systems like eligibility and claims. That's where you can get to the personalized answers. The language can be very, very natural. People can say yeah, or even respond in a different language, and the AI can respond in accurate language. Have empathy. It can have empathy. It does have empathy. It is not robotic. It's important in healthcare. This is important personal stuff. It handles tasks through to completion very reliably. We know there's no appetite for hallucinations in healthcare. There's no appetite at all for made up answers. And so AI is built with Usher that way. It passes training. It passes tests, just like live agents. It can completely explain and track why it did what it did, down to every single communication and interaction for auditability. It shows that it's achieving results. It shows where it got its answers. And it also, along with human intervention, continuously learns to get better. So you can go to the next slide. All right. I just wanted to dig in a little bit into, it's very, very different when you have secure and compliant AI for healthcare. And I wanted to get in a little bit 101 level on what that means, so that when people are looking for AI solutions for communications and engagement, they can understand what to look for. So guardrails ensure compliance. Guardrails are built into the Usher platform. Content filtering blocks inappropriate language, blocks hate speech, sensitive topics. It knows how to handle all of that. Crisis intervention. We all know healthcare has crisis moments, behavioral health crisis, whatever it might be. The AI needs to stop trying to answer in a crisis and immediately get people where the plan wants them to go, whether that be 911, 988, plan resources. That is an area that you just have to have nailed down. Bias mitigation, it ensures diversity in the training data, continuous evaluations for accuracy. Privacy and security, this is done through secure and completely encrypted end-to-end channels. So everything that goes on in these conversations is secure, is encrypted, is controlled at the end user level. So only those who need to see PHI see it. This has to be buttoned down. We know this, Jack. We're in healthcare. Legal and regulatory adherence and auditability. These agents are trained the way the plan wants them to be, but normally we don't want them giving medical advice. We don't want them giving legal advice. We don't want them giving financial advice. So they don't. That can be set up right within the guardrails, and the answers that it gives can be what the plan needs it to be. And then Off-topic steering, we know people like to have fun. Sometimes when they're talking to AI, we've had people come in and ask for concert tickets, recipes, for real. We've seen a lot. We've been running these for years. We will be able to answer politely, but let them know we handle really health related or member related questions. So all important things that are already done and buttoned up. So, and we can jump to the next slide. All right, so this is just quick. Another thing that's incredibly important with AI that's doing engagement is safety and security. Human in the loop, making sure that there's continuous monitoring. AI oversight, we actually have AI agents monitoring our AI agents. Think of them like your contact center quality people. And then human oversight, every single thing that is happening within the AI engagements is visible, is in dashboards, is in reports. There can be live supervision, feedback loops, escalation paths. And I'm going to share an example of some really neat things that this was able to see and immediately address. So I'll get to that in just a few minutes. I think it's helpful to have an example. The escalation paths, and it's fine to stay here on this slide, is just really people can click to call to get to any live resource. We have live agents, clinical and non-clinical, chatting live right within this HIPAA secure user interface. So again, helping to get people what they need, not have them have to drop from one channel and get to the other really matters, especially in experience scores. And then we know in healthcare, this is a big personal passion of mine, working with a lot of Medicaid plans, just in general. Proactivity and inclusivity are always important. It's a diverse world. So accessibility, ours is WCAG compliant for ADA. So we can work with people with differing abilities. People can speak instead of typing. There's a lot of things within the platform. Even the colors that are used within the platform are ADA checked. So as you're setting up your logo, as you're setting up your branding, that all matters. The font, making sure it's ADA compliant. Multilingual support, obviously incredibly important. We are supporting many, many languages. We are global, we are worldwide, and are supporting all types of languages. We are now up to 74, I'm really proud to say, and handle well even the languages that read right to left. I know that can be a problem digitally, but that is really well handled. So again, very important things to consider when you're looking at digital and AI solutions. The next slide. All right, I'm going to shift gears just quickly and go into some of the experience differentiators. So when you're evaluating, looking for digital, looking for AI options, omni-channel continuity, not handing someone off and having them have to jump to another channel. Keep them in the engagement as smoothly as possible until they get a task done. It really does matter, not just in the experience, but in the outcomes. Again, multilingual support and 24/7 availability. We can get to the next slide. So this is just a look at what the omni-channel continuity looks like in the Usher world. So there are member engagements that are going on seamlessly. There are outbound push messages to get members information they need, share education, capture information like addresses, share digital ID cards. And then there are inbound channels. So I like to say, people need to choose their own adventure in their engagements. You may be reaching out to them about medication adherence, and they may have a question about finding a PCP. That should be supported, and it is. That's how you handle healthcare communications the way that people expect them outside of healthcare. Getting SMS can be a great channel, email to lead them into the HIPAA secure channel. These AI agents are embedded. They are on home pages of health plan websites. They also handle provider service. So they're on provider service pages of websites. These can plug in wherever you are. We're even on inbound IVRs as an option. So really, the omni-channel, very important, pushing information, handling inquiries. And the rest of this I've really gone through. So I'll just jump us to the next slide. And so these are some of the things I thought it would be neat to share. We have been running AI agents on home pages. We started out on the Medicaid side. We're doing Medicare, we're doing duals. These tools have really proven to be an amazing voice of the member. Jack, I know you mentioned that a bit in your research. You cannot imagine what people will ask. And I have just been absolutely fascinated. I work in partnership with our clients and we look at what's coming in. We were set up with our first Medicaid clients to handle their top 10 member service call drivers. The normal things. I need my digital ID card. I need to change my address. I need to find a new PCP, a pediatrician. I might have a claims question. We were completely ready to go and able to handle those. And as soon as we went live, we saw a huge spike because it was after hours in people asking questions about the ER. And it was, in hindsight, something we could have thought of, but really didn't. It was just the #1 trending. So these are actual inquiries. I need urgent care. I have 101 temperature and cough, headache, and need help. Hi, I'd like to know what urgent care clinics are around the area of my zip code that take my insurance. This one I love. This was common. Is there a difference, according to you, between emergency care and urgent care? So you can read the others, but what an amazing opportunity. These are coming in by the thousands. And what we did is immediately, through our oversight, started to put in answers to these, getting people to urgent care instead of ER, getting people immediately to telemedicine, getting people to nurse advice lines. So being able to resolve it when the member is thinking of going to the ER. And then also we added in push campaigns. We knew that this was something that was a gap. And so we did some push educational campaigns as well along those same topics. So really powerful. Just one example of true ROI impact just from inquiry handling. And we can go to the next slide. This one I love, being a healthcare consumer myself. AI agent inquiries are an amazing lens into the voice of the member. We have found across all of our clients that many things that are coming in through the members are topics that people aren't asking live member service agents. This is when member service is open or closed. We're getting inquiries on sensitive topics that people really need help with. They're demonstrating that they're more comfortable asking a digital agent rather than a live human. So the sensitive health topics, these are very high volume. Housing assistance for the unhoused, sexual and reproductive health, mental health, substance abuse, maternal health, domestic violence. The rest of the list is here, but these are real inquiries. I just pulled some of them that have been able to be addressed. We went in and trained the model, and it now handles, I'm homeless. I'm unable to make doctor's appointments. Can you help? The AI agent handles these now. I need to get into rehab. How do I do that with you as my health plan? I want a doula to support me during my pregnancy since my GYN is not supportive. Do you cover that? This is incredible to me. This is a voice of the member. This is also something that we can beef up, and we immediately beefed up the model, the LLM, behind the scenes to answer these the way the plans wanted. And they were also able to add these again into their outbound digital push engagements. So being able to add doula support into their maternal health journeys as an example. So I just have one more quick wrap up, and then we're going to show you what this looks like in action. So you can go to the next slide. So these are, I'm really incredibly proud of what this is. AI agents built for precision, compliance, and scale. They launch incredibly quickly. We have launched these, within a month. This isn't something that takes weeks, years. They can be started with a handful of use cases. We frequently start with the top member service or provider service call drivers, launch with that, listen, and continue to build. And that's something that I love that we work with Engages on, just to figure out, how do we get going? Because time is really important in these budget constraint times. So seamless, scalable, built with domain knowledge and intelligence, no room for hallucinations. We understand that. I understand it. I've been in the shoes of a lot of our marketing communications leaders. And then rapid ROI, faster time to value. So we have more than 30 pre-built push campaigns in the platform, everything from member welcome, digital ID, card delivery, medication adherence, care gap closure, that are built with our best practices, your best practices, that literally can get people started even quicker. They're just a click to get started and modify. So we know there's no time to waste in healthcare, and are ready to, get going rapidly. So that we can just go to the next. One more. I covered some of this. How do you get started with AI, with digital engagements, going from where you are to where you need to be to meet all the goals that Jack shared that you're looking for? Again, start simple, build trust. The more you reach out and get people valuable information through your digital communications, the more you handle their inquiries to completion, the more they'll trust you. So the more you keep going, the higher your engagement rates will go. People do look for these messages and ask for help. Again, train your AI agents like you do live ones. They will respond accurately. Reinforce behavior, helping people to take complete actions. It can be done digitally, especially with Engages' amazing behavioral science work, and scale naturally. And as I said, this is a great way to augment your workforce. So freeing up live resources for the highest value use of their time. So that is the end of my portion, and I'm just going to ask us to run a quick video, and then we'll jump to some Q&A. I'm not hearing it.
Yeah, Tara, we're not hearing this. I'm sorry. Is there something?
Tara, would you mind trying to replay? Maybe turn your speakers up, please. Well, it looks like the volume, unfortunately, is not coming through, but we will be sending all of the materials out after the webinar, and we can include the demo in those materials.
Always happens live. We literally just read through this. But thank you, everybody, for your patience.
Yeah, thank you. So I guess that's a great segue for our Q&A. And we did get a lot of questions coming in to the chat throughout the session. So I'll start off with one of those. So what are some ways our team can start using AI now to improve member engagement?
Yeah, I'll take a jump at this and then maybe pass it to you, Yvonne. So I think some of the things that, again, consistent with the sorts of constraints that health plans see, that the challenges and complexity of the environment, I think starting with things, like what Yvonne was describing, that are maybe internal or non-member facing applications might be a place to start, right? Helping people, content developers, get a jump on materials that they need to develop. Working on ways that, and again, I think that's a good example of what's the phrase you hear frequently is, it's not that AI is going to steal your job, it's that the person sitting next to you who is using AI is going to steal your job, right? And so it's one way to help folks become more efficient. The other way, I think, is, and one of the things when we worked through this presentation that really struck me from that Yvonne had was that whole idea of folks reaching out and asking for help around sensitive topics, right? And so I think that's another place to start, right? That's like life-changing, important information to help people get into rehab or housing or social service kinds of things, but is often hard. If it's hard for people to ask other people for that kind of help, let's find ways to get that to them that does work. And so that's another place to start, I think. Yvonne, is there anything you want to build on that?
No, I think you got it perfectly. Thanks, Jack.
Great.
Thank you. So another more tactical question here. Yvonne, what measures did your team take to ensure that AI is HIPAA compliant?
Great question. So we've actually been investing in that. We've been in healthcare for many, many years. And the main thing that we have done is we are HITRUST certified. So HITRUST R2. Our platform, all engagements, all communications, whether they be push or AI agent inquiries, are secure and encrypted end to end. If someone is using a phone to access any of these engagements, nothing is stored on their phone. We may have them take a picture of an ID card or upload something, but that is not stored on their phone. Everything is done in this secure, encrypted back and forth channel. And also the data that's received in for the targeting and push back out through FTP or secure FTP, everything that's captured is also secure and encrypted. So we know the criticality of healthcare data, PHI, PFI, and PII. And also we are also have a lot of other compliances. So we can capture financial information and we can get some of that over it's as well on some of our, we're HITRUST, PCI, SOC 2. So we've been investing for more than a decade in all of those compliance areas. We are only supporting regulated industries, and we know there's absolutely zero reason or margin for error. Does that help?
Yes. Yeah.
Thank you for the question.
Yeah, thank you. And I know we had talked a lot during this webinar about ROI and the results showing that ROI is now of top importance. So given that as engagement budgets are getting tighter, how can we maximize ROI?
Yeah, I think one thought on that, and again, I sort of alluded to it during the presentation, is to look for opportunities to tie whatever it is you're asking folks to do to opportunities to control costs, right? So I think Yvonne was talking about digital ID cards, right, which are just remarkably bureaucratic, or getting a new ID card out to somebody turns out to be just a remarkably bureaucratic and expensive process when you can just refresh a screen. Or I think at a more at the other end of the spectrum, you can really start to do things like drive people to different places to get care, right? I think even including freestanding clinics, for example, as places to get your colorectal cancer or your mammograms is a great way to save money. ER avoidance is another. reducing, thinking about and including reducing churn and retention as important elements of maintaining member satisfaction, I think is important. I was at a conference this week where they were talking about once people switch from one Medicare plan to another, they're significantly more likely to switch again, right? They've kind of broken that barrier. And so what that means is that if you grew by getting members from somewhere else this year, you're going to have to keep an eye on those folks. Are going to be flight risks this year, right? And so you got to keep an eye on them. And if you can engage them efficiently and then count some credit of retention towards your results, that's going to be tremendous gains for you.
And I'll jump in as well. I think not just operational efficiency, but health and wellness outcomes. So these types of communications are
to help people. Yes,
they're getting people to primary care doctors. They're getting people to pediatricians. They're getting people to specialists. And even medication adherence. With us, we, together we know you need to ask why they are not adherent. Don't just nag, get it filled. There are a lot of reasons people don't fill. Could be cost, could be transportation, could be I'm not taking it anymore. You can ask and actually overcome it. We're doing mail order delivery of meds. We're doing transportation to appointments. It's really going that last mile and supporting people, which can be done digitally, to get the care, the support, the resources, getting them to take their meds, close care gaps, you name it. So it's really, we have some plans that have 900 use cases running on the platform across, sales retention, quality, claims, even prior auth, with all the new regs coming on, the timeliness of that. That can be handled. It's digital communication. So
great, thank you. Let me check the Q&A box here. So what are some of the use cases that you're seeing clients start with when they launch AI agents? Like where to start? And are they behind the portal firewall?
Oh, excellent question. Thank you so much for that. So I'll start with the second question. Most of our clients have these AI agents for member service as a really amped up chatbot on their homepage. We can answer general inquiries, and as soon as they need something specific to them, we can authenticate through information they have easily available. And usually we're starting with the top 5 to 10 member service call drivers. And because we know those are what members are asking, we get it running, get it trained, and then quickly watch and see what else comes in. And welcome you, Jack, to jump in on anything from your perspective.
No, again, I think that's spot on. I loved when you presented that material was following the behavioral science rules that we had tried to live by, right? Starting with something small, reinforcing positive behavior, building on that momentum. And so I think if you can find those kinds of things, you could
and even some of the things that we all know important. We have a little progress tracker bar. We're getting people through complete health risk assessments like duals. You just need to encourage. They need to know how much longer they have to go. You can put encouraging messaging along the way. You can, really do anything you can to hold their hand until they take the action. And really that's the key. That's the key, is just understanding what it takes to get the true outcomes, which again gets back to that other question about ROI.
And never underestimating those small nudges and small features that can actually deliver major outcomes.
And then being able to provide that level of service it gets people coming back for more. They know they can trust their plan. They know they can get to their plan 24/7. They'll come back. They look for these messages. So it's a great cycle.
Yeah, building that trust and loyalty for sure.
Right, and that helps. And that helps change the behavior as well, right? Once you start to get a different, you start to see that it works. Right. People, it becomes sort of reinforcing then as it goes. Right.
So true. And it looks like we have one more question, but as I'm gearing this up, Tara, if you would like to try to share the slide deck one more time. So I'll ask this as we're pulling the slide deck up once more. Oh, where did it go? Oh, okay, here we go. How have you both seen the health plan clients you've worked with get past AI committees, regulatory liability? There's so many governance concerns. Any recommendations around that?
Yeah, we've done that a ton. So we've gone in front of everything from internal committees to state departments of Medicare, Medicaid, to all the way up the chain. It is really how the AI is built. The HIPAA security, the high trust, the ADA compliance, the secure encrypted nature of it, and really the auditability. So being able to get to every single interaction, every single thing that happened, where the answers came from, is an incredibly important audit trail. And so we've gotten through the security, the regulatory, the compliance, the legal teams, states, counties, you name it, because of all of that. That's something that we've invested a decade into, that compliance, that liability reduction, even things like the guardrails. We don't answer things we should not answer. That is all that what those committees are looking for. They just want to be assured. And we've gotten through some of the biggest of the big, and starting in Medicaid. So I feel like if you can get through that in Medicaid plans, you can get through it and not anywhere. So
yeah, I would just add making sure that you have good and senior executive sponsorship throughout that process as well, right? Yvonne's talking about hitting all the check boxes, but I think it's still helpful to have someone throwing some weight around in addition to that.
Great point. That buy-in is critical. Okay, so we're going to try one more time for video. Let's see. Fingers crossed. Drum roll.
This is a demo of Usher's AI agent for member service, utilizing our advanced voice capabilities. Let's look at the current process of a member calling in to request a ride for an upcoming appointment. The call center agent speaks with the member and gathers the required details, which they then pass to a transportation specialist. Now let's see how Usher can automate this process. Using AI, we allow the member to simply speak the details for their request, which are captured and sent directly to the transportation specialist. This frees up the call center agent to take call types that are more complex or need human attention. Here's a basic example of what this interaction would look like in production.
We're happy to help schedule a ride for your next medical appointment. Let's start by confirming your identity. Please tell us the last 6 digits of your social security number.
447890.
What is your date of birth?
January 1st, 2000.
What day is your appointment scheduled on, Stephen?
June 27th.
What time do you need to be picked up?
8:15 a.m.
What is the exact pickup address?
298 Madison Street, Santa Clara, California, 95050.
Please tell me the facility name or address of where you're going.
Valley Medical Center on Bascom Avenue.
You need a ride scheduled for after? If so, what time?
10:30 a.m.
What kind of medical appointment is this?
Physical therapy.
Will you require wheelchair or gurney assistance?
No.
Great! A transportation specialist will be in touch about details for your ride on June 27th at 8:15 a.m. Thank you.
The details have been captured in an electronic format to make them easy to validate, transform, or distribute as needed. We can also enable the member for self-service to prevent these calls altogether. Imagine an AI agent that can conversationally answer any questions around basic FAQs, a member's policy, or standard plan information. Beyond being informational, we can also allow members to request rides, find new primary care providers, download ID cards, or perform any other task right from their device of choice, and of course, being able to connect with a care manager if they chose. Meet Usher's AI agent for member service. This is your AI agent that can provide all of this functionality and more directly to your members. Let's have a look. This AI agent can be hosted directly on your main website or within your member portal. Trained on your plan documents, policies, and site content, your AI agent offers your members a conversational way to get their questions answered. Powered by Usher's advanced large language model, the Usher AI agent goes beyond just relaying information by being able to parse tables, perform calculations, and understand both intent and...
So I noticed we are up at time. So just wanted to wrap so we don't go too far over. So we will be sending this demo out along with the slides, the webinar recording, and some additional resources. And I just wanted to say thank you all for attending. And of course, thank you, Jack and Yvonne. It was an incredible presentation.
And thank you for the wonderful questions and engagement. And we will be here if you have any follow-up questions. Thanks so much, Jack. Thanks so much, Lindsay. This has been great.
Thank you all. Have a good afternoon.
Bye-bye.
Bye.